trying. Everybody get. Okay, and so tell me which wrist it is.
It's the right wrist.
And tell me where particular it hurts.
Right here.
Okay, and tell me, does the pain come and go, or does it stay all day?
Comes and goes.
All right, and could you tell me a little bit more specifically about the pain? Is it sharp, dull, aching, stabbing, gnawing?
It's sharp.
Okay, sharp pain. And can you tell me, is there anything associated other than just the pain in your wrist? Is there any pain going up your arm, any numbness or tingling in your hands? All right, and anything that makes the pain better?
If I don't hold something.
Okay, anything that makes it worse? Holding something, or using your wrist?
Yes, using my
Okay. Have you done anything to help alleviate the pain, like ice or
Ice.
Okay. Has it helped at all?
A little bit.
A little bit. And have you taken any pain medication for your pain?
Just actually
When did you last take it?
yesterday.
Yesterday. Okay. And on a scale of 1 to 10, 10 being the worst pain you've ever felt, 0 being no pain, can you tell me the pain that you're in right now with your wrist?
It's about a 2.
Okay. Do you require any pain medication or anything right now? All right. So I will relay that information to the doctor about your wrist. First, I'm going to give you a good once-over. Okay? It's going to be quite lengthy, so just let me know if you have any concerns, any discomfort, or any pain associated with anything that I'm doing while we're doing the assessment, okay? All right. I noticed from the chart that your blood pressure is 115/70, your pulse is 70, your respirations are 12, your temperature is 98, so those are all within normal limits. We also did some biometric testing on you. Your height is 6 foot and your weight is 180. That puts you at BMI around 24, which is within normal limits. If it was either over or under that normal range, then we would talk about nutrition, diet, or exercise. Okay, so just keep doing what you're doing. Okay. All right, so I am going to get started. The first thing I'm going to do is I'm going to be looking at your hair and looking at the color is well distributed. It's also just well distributed in the amount and the location of it. Also, I see no parasites or excessive drying. The texture is within normal limits. It's not excessively dry. Okay, and now I'm going to be looking at your scalp. Your scalp is within normal limits. I don't see any areas of concern, no rashes, no lesions, no moles. I don't see any excessive drying or flaking anywhere, so that's within normal limits. I'm also going to be checking out your skull. Your skull and your head is normocephalic, and I'm going to palpate. Any pain or tenderness? Okay, and there's no areas of any depressions or deformations noted. All right, I'm going to be coming down to your face. Your face is symmetrical. The color is within normal limits. It's pink. There's no areas of cyanosis noted. The skin of your face, it is within normal limits. I don't see any rashes, lesions. I see just a few pinpoint moles here and there. Going to get some tangential bleeding. But they look within normal limits as far as the ABCDE criteria. I see everything else appears within normal limits. The hair distribution is normal for a beard. I can't really assess too well the skin underneath the beard, but it appears like there's no lesions or anything under there. The skin appears, or the hair appears clean. There's no parasites on that hair as well. Okay, I'm looking at the eyebrows, and the eyebrows are symmetrical. There's no drooping. There's no signs of parasites or infections. I am looking at the external structures of the eye. The eye lids, there's no drooping. They are both symmetrical in the shape of the eyes and the position of the eyes. The eyelashes, there's no signs of infection anywhere. The hair is well distributed. Looking at to see, I said there's no drooping of the eyes. There's no drainage in the eyes. I'm going to be pulling back your conjunctiva, and the conjunctiva is pink, so there's no signs of anemia. It's not excessively red for any conjunctivitis or anything, and there's no discharge. I'm going to be palpating your lacteal apparatus. Can you tell me if there's any pain or tenderness? Okay, and there's no discharge also when I palpate it. So now I'm going to be looking more at the internal structures of the eye. The sclera is mostly white. There are some pinpoint areas of redness, probably from just being also did some visual acuity testing on you. Your vision was 20/20, both eyes corrected with your contacts. And so that was visual acuity. And so I'm going to be testing your near vision. If you could hold this card about there, okay, and then read this one sentence for me right there.
In good light, hold this card 14 inches from your patient's eye.
Okay, cool. All right, so there was no presbyopia noted in both the Rosenbaum chart testing and the visual acuity testing. That shows that your cranial nerve number 2 is intact. All right, so now I'm going to be looking more at some pupillary testing. So first, I'm going to be checking the size of your pupils, and they are both, look at me, thank you. They are both about a size 4 bilaterally, so they are equal and they are round. And so, okay, so now I'm going to be checking their reactivity to light. So if you could just look at me, and I'm going to be shining light on this one, and there is direct constriction of the left eye, and I'm going to be shining it again in your left eye, but then I'm looking at the opposite eye, and there is consensual restriction. Doing it again on this right eye, there is right pupil direct constriction, and now there is left pupil consensual constriction. Okay, and so now I'm going to ask you to look at this pen light. Okay, and then look over my shoulder. Okay, good. So your pupils accommodated to near and far vision. So now both your pupils are equal, round, reactive to light, and accommodation. All right. So now I'm going to be doing a few other things. If you could just follow my pen light. Okay, good. So that was testing extraocular movements with the 6 cardinal fields of gaze, and everything was within normal limits. There was no nystagmus present, and that also showed that cranial nerve 3, 4, and 6 were intact. All right, so one last thing for the eye. You doing all right? Okay, and your height is good for me. Okay, so I'm going to get pretty close to you, and I want you to tell me, this is going to be testing your peripheral vision, and so just let me know which fingers are going to be labeling, okay?
Left hand or right hand? Left hand. Left hand. Right hand.
Okay, cool. So your peripheral vision is intact. All right, so that completes the eye examination, I think. Thank you. All right, so now I'm moving down to the nose. The nose, I'm just going to be looking at the skin again, and like I said before, it was within normal limits. This nose is symmetrical. There's no areas of deformation or any masses, and it's positioned centrally on your face. Any pain or tenderness? Okay, good. So now I'm going to be looking inside. Tilt your head back for me. All right, and I can see the mucous membranes are pink. There's no lesions present. I can see the turbinates are within normal limits back there. They're not big and foggy and excessively red, and there's no drainage, discharge, or foreign bodies noted. All right, so I am going to be testing your sense of smell, and I'm going to be testing 2 different scents. And what I want you to do is, when I tell you to close your eyes, hold one nostril down, and identify the smell on the opposite nostril, and we'll do both sides. Okay? All right, go ahead and close your eyes for me. All right, close one nostril, please. All right, identify the smell.
Is that pepper?
Yes. Okay. Close the other nostril, please.
Coffee.
Yes. All right, good. So cranial nerve number 1 is intact. You identified those correctly. All right. So now I'm going to be testing your sinuses. I want you to let me know if there's any pain or tenderness when I palpate. This is the frontal sinuses. Any pain? Maxillary sinuses, any pain? All right. So those are within normal limits. So now I'm going to come down to your mouth. Your mouth is symmetrical. There's no drooping. The lips themselves, they're not excessively dry. There's no lesions present, no vesicular lesions particularly. And they, like I said, they're not excessively dry. They're within the normal limits of moisture. And I'm going to palpate. Any pain or tenderness?
No.
All right, good. So now if you can lift the top of your lid up for me, your mouth, the lip. Okay. And it is pink in there. It is moist. There's no lesions. Okay, good. And down below? Same thing. It is pink. There's no lesions. And it is moist. All right, good. So if you can smile for me, and that is cranial nerve 7. Okay, thank you. Voice from above. And then if I can ask you to clench your teeth. All right, and that is cranial nerve number 5 for the motor portion are white. There's no areas of decay. I can see your gingiva, and your gingiva is not inflamed, not excessively red, no areas of infection. Okay, and could you open your mouth for me? I'm looking at the rest of your teeth. There's no dental caries, there's no decay. The gingiva is within normal limits, there's no inflammation. And I'm looking at your buccal mucosa, and it is moist, there's no lesions, and it is pink. Okay, if you can stick out your tongue for me. Okay, your tongue is pink, it is symmetrical, it is moving symmetrical also, there's no lesions, and then stick your tongue up. All right, same thing, it's pink, moist, no lesions. Side to side for me. Okay, and that tongue movement showed that cranial nerve number 12 is intact. Okay, and so say, I know this is hard. One more time, and I want you to say ah for me real big.
Ah.
Okay, ah. With him saying ah, that is cranial nerve number 9. The soft palate rose midline when he said ah, and then the uvula is also midline, and then say ah one more time for me. The tonsils are about maybe 1, 2 plus on each side. There's no evidence of any infection on the soft palate or any crypts or any infection on the tonsils. Okay, good. All right, so mouth is completed. And so now I'm going to go to the ears. So the ears are placed where they're supposed to be on both sides of your head. Good position with the corners of your eyes. Very good. I don't see any evidence of deformations or any masses. The skin also looks within normal limits. There's a few moles, but they fit the ABCDE criteria well. All right, I'm going to be looking inside of your ears. Actually, any pain or tenderness on the auricular pinna?
No.
Any pain on the tragus? Over here? All right, good. Look inside. And inside, there's no excessive cerumen, there's no drainage, there's no discharge, there's no infection, there's no foreign bodies. Ditto. Okay. Everything's good with there. Okay, I am going to come behind you and I'm going to test of your hearing. If you could just repeat the words that I'm saying, each ear at a time, okay?
Baseball. Traffic.
Okay, so that's cranial nerve number 8, and that is intact. All right, so now I'm going to be looking at your neck. You doing okay? I know we're only on head. We're going to get there. Okay, so your neck is supple. It is healthy looking. The muscles are, like I said, the muscles are supple. The skin is within normal limits. There's a few areas of redness, but they don't look infected. Moles fit within the ABCDE criteria well. And your trachea is midline. If you could swallow for me. Okay, good. And swallowing is cranial nerve number 10. And there's no evidence of thyroid enlargement. All right, so now I'm going to be testing your lymph nodes. When I'm going to be assessing lymph nodes, I want to note their location, their size, to see if they are mobile or fixed, and to see their consistency as far as if they're soft or hard. And if the patient has any pain or tenderness associated with the palpation of them. Okay, so this is preauricular, postauricular, occipital, tonsillar, submandibular, submental. It's kind of hard with all of this niceness here. Okay. This is superficial cervical. There's deep cervical, posterior cervical, and if you could shrug your shoulders against some resistance. All right, keep going. All right, good. And this is supraclavicular, and you shrugging your shoulders against some resistance was cranial nerve number 11. Never gonna forget it. Okay, so now I am done with HENT. I'm gonna remove my gloves. You doing okay?
Yes.
All right. Am I doing okay? Okay. All right, so now I am going to start examining your thorax. I'm going to start from the back. Let's pretend like I would be walking around, but you're flipping. Okay, carefully. All right, if you could remove your shirt from me, sir. Okay. All right.
That was a guy.
He's so oogling to himself. Not to name any names. Okay, so I'm looking at your posterior thorax, looking at the shape. It is the anterior posterior ratio is 2 to 1. It is symmetrical. I don't see any areas of mass They fit within the ABCDE criteria, and everything else on the skin looks within normal limits. The first thing I'm going to do is I'm going to just palpate for pain and tenderness. Any pain or tenderness anywhere?
No.
Okay. And I'm going to be testing for tactile fremitus. If you can, every time you feel my hands move, if you can say the words 99, okay?
99, 99, 99, 99.
Okay, good. So symmetrical vibrations were felt, and that is within normal limits. No excessive fremitus was palpated. So now I'm going to be testing for chest expansion. And I'm going to be putting my hands in the T9, T10 area, and I'm going to be squeezing it. If I can get you to take a deep breath. All right, good. So symmetrical expansion was noted. And so I'm going to be testing for CVA tenderness. If you could just let me know if there's any pain or tenderness. Okay, so no CVA tenderness was noted. All right, so then I am going to auscultate. Every time you feel my stethoscope move, if you can take a deep breath in through your mouth and out through your mouth, okay? And let me know if you feel any dizziness. You okay?
Can't see.
Okay, good. So lungs were clear to auscultation bilaterally. All right, if you can flip over for me, or I would be moving around. You doing okay?
Yes.
Okay. Sorry, you're all redheaded. Can you take a breather? Okay. So,
Breathers.
okay, that's right. So with the anterior thorax, I'm just going to be checking for pain and tenderness. Any pain or tenderness?
No.
Okay. And so now I'm going to just move to auscultation. Well, actually, I need to look, right? Yes, I need to look. So looking, the chest or the anterior thorax is symmetrical. I see that there is some normal pattern hair, which is well distributed. I see some splotchiness, but that's okay. No other areas of concern noted. Everything else is symmetrical. No excessive work or breathing. No use of accessory muscles to note that there's any respiratory distress going on. So then I would palpate for pain and tenderness, and he said no. Okay, so now I'm going to be auscultating. So once again, lots of breathing, okay? Let me know if you need a break.
Okay.
Okay. No, it wouldn't. That's fine. Okay. So the anterior thorax, the lung auscultation was clear to auscultation bilaterally. Okay. So is thorax complete? Okay. So now I'm going to be checking your cardiac system. So the first thing I'm going to do is I'm just going to be auscultating. So just relax. Breathe normally. Okay, so the first thing I'm going to do is I'm going to locate all of my landmarks. So this is the first intercostal space, second intercostal space, that's right sternal border, so this is my
Monic.
aortic. Second intercostal space, left sternal border, that is pulmonic. Third intercostal space, left sternal border,
Oops, point.
what is that? Herb's point. Fourth intercostal space, left sternal border,
Tricuspid.
tricuspid. And fifth intercostal space, midclavicular line, that is mitral. And this is also the apical pulse, and I can listen to it for 1 full minute. Okay. So I'm switching over to my bell, and I'm going to be listening to the same places with my bell. which is within normal limits. No arrhythmias noted. And I heard no S3, S4, rubs, clicks, gallops, or murmurs. Okay, so now I'm going to get you to lie down. You okay? Oh, you know what? You want to put your shirt on? No, don't put your shirt on. Okay. No, you can put your shirt on. Okay. So now with the cardiac, I'm going to be looking for the general contour of the precordium. I don't see any lifts or heaves. I'm also going to be, I guess I did need your shirt on. I'm going to be looking at eye level to see the apical pulse. And I actually do see it, and it's not bounding. It's within normal limits, about 2+. I'm also going to be palpating with my palm and my finger pads for any lifts, heaves, or thrills in the areas of the valves, my abdomen. Okay, and finger pads. Okay, and while I'm here, I'm going to try to palpate the apical pulse. I feel it slightly, so it's okay. All right, and I didn't feel any thrills in those areas either. All right, so now I'm going to go back to auscultation in the same areas that I did previously with my diaphragm and my bell. Okay, and you could just lean left for me a little bit. All right, cool. And now my bell. Okay, and once again, with my bell and my diaphragm, I heard S1 and S2, which was within normal limits, and no S3, S4, rubs, clicks, gallops, and murmurs. Oh, and I forgot to say with the lungs, there were no crackles, wheezes, and rhonchi. Make sure to say that even when you say that it was clear to auscultation. Okay, so now cardiac is complete. Now I'm going to move to your abdomen. So if you could lift your shirt up for me. Okay. I would do that after. Okay, no. Okay, with my neck, I'm going to put you at 30 degrees. Thank you. Voice from beyond. Okay. I always tell you, forget something. Okay, so with the neck, I'm going to be looking with tangential lighting. I don't see any jugular vein distension. All right. And now I'm going to be assessing your carotids. First, I am going to be palpating one at a time, not to occlude blood flow to the brain. Okay. And they're both 2+. Now I'm going to be auscultating them to listen to see if there's any bruits with my bell. Can you hold your breath for me a second? Okay, good. You can breathe again. All right, hold your breath again. Okay, good. Now you can breathe again. All right, so there's no bruits. So do that before cardiac. Yeah, I always mess up on something. No perfect video. Okay, so now I'm going to be checking out the abdomen. I'm going to first just be looking at the contour of the abdomen. It is flat. It is not scaphoid or protuberant. Skin is within normal limits. Just a few nevi that are within normal limits. Hair distribution is within normal limits. And I see no scars. I see no striae. I see no areas of masses of bulging. Everything is moving symmetrically. And I'm also going to be looking at eye level for the aortic pulse. Can you hold your breath for me? Okay, and I see it slightly off midline, in between the umbilicus and the xiphoid process. Okay. All right, so now I can auscultate, because that's my next step in the abdomen. So I'm going to be splitting the abdomen into 4 quadrants, and I'm going to be assessing first with my diaphragm in each of those quadrants for vowel sounds. Starting with right, lower, right. Oh dear. So much lunchtime. Okay, vowel sounds are normoactive in all 4 quadrants. And now I'm going to be assessing the abdominal arteries. So starting first with the abdominal aorta with my bell, renal arteries, and the femoral arteries. And there was no bruise noted on auscultation of the arteries. All right, so now I'm going to do palpation. So cold hands, okay? First, I'm going to be doing light palpation in all 4 quadrants. Oh wait, do I do palpation or percussion? Percussion, okay. So now I'm going to be doing percussion in all 4 quadrants, okay? All right, so first I'm going to be notating that I would expect to hear some dullness in the right upper quadrant where the liver might be. I might hear some tympany where the gastric bubble is on the left upper quadrant, where I might hear some dullness over the area of the spleen, especially if it was enlarged. Otherwise, I would hear tympany over the majority of the abdomen. I might hear some dullness over the lower colon. Okay, everything is within normal limits. Now I'm going to be palpating, and I'm just going to be doing some light palpation for pain and tenderness. Let me know if you feel any. Okay, and now I'm going to be doing some deep palpation for organ enlargement or masses. All right, and no masses or enlarged organs felt. Okay, so now abdomen is complete. So now I'm going to be doing peripheral vascular of your upper and your lower extremities. And so first I'm going to be looking at your arms. First I'm going to be looking for the color. Bilaterally they are pink. I don't see any areas of paleness or redness anywhere. I'm going to be looking at the skin also. Hair distribution is within normal limits. There is some vasculature noted, but nothing appears within normal, outside of normal limits, I should say. There are some nevi present, but they fit within the ABCDE criteria well, so they are within normal limits. I don't see any edema. Let's see, color, edema. I'm looking at the hands, and the hands are within normal limits. The nails, they are healthy and within normal limits. There's no edema also in the hands, and there's no clubbing of the fingernails. Okay, so now I'm just going to be feeling for temperature everywhere. Everybody's warm to me. So they are bilaterally and symmetrically warm. There's no areas of increased warmth anywhere or redness. And I am going to be palpating a few things. First of all, there's no edema. If there was any edema, I could do pitting. I'm going to be checking for turgor, and there is no tenting. And I'm checking for capillary refill, and it is less than 3 seconds. Okay, now I'm going to be palpating for your epitrochlear nodes, and there are none present. Okay, so now I'm going to be checking for pulses, and the first one is going to be your brachial artery. Okay, and that's 2+. Radial, 2+. Ulnar is also 2+. 3+. And 2+. Okay, so all pulses are 2+. Am I forgetting anything for the arms? No. Okay. So now down to your legs. If you could pull your shorts up just a little bit for me. Okay, so your legs, looking once again at color, there's a tan line. There's no redness or excessive swelling noted. The hair distribution is within normal limits. There's no areas that are without hair. There is some nevi, and they are within normal limits. There's a scratch here. How'd you get that?
Roommate's cat.
Oh, that's a roommate. Okay. There is some older scars, but they appear within normal limits, but this is not infected. So, you know, cats are yucky, so keep a watch on that. Everything else appears within normal limits. There's no edema in the lower extremities, which happens most often down below the knee. I don't see any edema anywhere in the legs or the feet or the ankles. The toenails appear within normal limits, and there's no clubbing. Okay, I think that's it. All right, so palpation, the temperature is warm everywhere. There's no coolness or excessive warmth anywhere. And I am going to palpate. Okay, inguinal nodes are not palpated, and the femoral pulse is 2+. I'll check the rest of the pulses out. Bend your leg for me slightly. Popliteal. Sure, it's 2+. Okay, 2+. And, okay, thank you. Dorsalis pedis is definitely 2+ for this one for me. Okay, and posterior tibial. Okay, good, all 2+. While I'm down here, capillary refill is within normal limits. I'm going to squeeze by you here. If I can. Sorry. So once again, I said capillary refill. If there was any edema, I could palpate it to see if, or pit it to see if it's pitting. I'm going to be doing a neuro test on you really quickly since I'm down here. I'm going to be moving your toe in different positions. Okay, this is up and this is down. Close your eyes and tell me which way it is, okay?
Down. Up.
Okay. All right, you passed. All right. I think that's everything with legs. And, thank you. Okay. Bend up both of your legs for me. Okay. I'm going to be looking, and I don't see any areas of redness. I don't see any swelling. I'm going to be feeling for any temperature. Okay. And any pain anywhere? Okay. So there's no evidence of a DVT present. Okay. Yeah. All right. So now that peripheral vascular is done, it's time for me to start with musculoskeletal. You doing okay? You cold? No. Okay. So the first thing before I start musculoskeletal is I am going to be inspecting and palpating every joint for any signs of inflammation. So it'd be redness or swelling. If there's heat associated with it, if he had any pain, I could also be palpating for edema, pain, and crepitus in every joint. So pain, 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 pain. Okay, so now we can start. So first I'm going to start with the hip. So if you can, one at a time, if you could flex your knee to your chest. Okay, and that is flexion, right down. And this one, that is flexion, okay, down. There's some crepitus. I always feel for crepitus for me. Okay, if you can, okay, safely come to the side of the bed, and I want you to drop your leg all the way off. Okay, cool, that is extension, and we'll pretend that we do it on the other side. Okay? So move over, drop the leg. I'm doing this for time. Okay. So that was extension of the hip. And now if you can flex this knee to your chest again for me. Oh, actually, put it down for me. Okay. There's something here. Pull it out towards me. That is abduction. And then across your midline, that is adduction. Same thing on this side. Away from you. Abduction. And then adduction. Okay, cool. Okay, so now flex this knee to your chest for me. This is external rotation, and then that is internal rotation, right? Ooh. Okay. External rotation, internal rotation. All right. So that concludes hip range of motion, and now I'm going to be doing those similar movements, but with against some resistance. Okay. So push up against me, all right, and then down against me, all right, out to the side against me, in, out to the side, in. Again, we don't have to do anything with rotation. Okay. So that completes hip. If you can move over there and sit for me. You doing all right?
Yes.
Okay. So I'm going to start back up at the head. So if you can, where to stand? Stand back here. So everybody can see. Okay. If you can flex your chin to your chest for me. All right. That is flexion. Back up to midline or regular. Now look up to the ceiling. That is extension. Okay. Now back to regular. Now put each ear, touch each shoulder. All right, that is lateral bending, and then look over each shoulder, please. And that is rotation. Okay, and so back against my hand, forward against my hand, side, and side. All right, good. So that's head. Okay, so now we'll go back to shoulders, elbow. So if you could straighten out your elbows for me, flex them. That is flexion of the elbow, straighten them out. That is extension. Okay, if you could put your palms facing down, that is pronation. Now put them back up like you're holding a bowl of soup. That is supination. Okay, so against resistance, you're going to be flexing up against me and straightening them against me. Okay, good. With your wrist, hold your wrist out like this for me. And if you can, point your fingers towards the ground. Okay, and that is flexion, back up to regular. And now point them to the ceiling. That is extension, back to regular. Away from you, that is abduction. And in towards your midline, that is adduction. All right? Put them out again for me. And then you're going to be doing this maneuver against me. Okay, and then up. Okay, and then out to the side, inside. And then if you could grip mine, squeeze my fingers. Very good. Bilateral grip straight with the normal limits. All right, the knee. So if you could straighten out your legs for me, that is both of them. That is extension. Bend them. That is flexion. I'm going to help you with this. Just very slight movements. This is external rotation, internal rotation, external rotation, internal rotation. All right. And so if you could straighten against me, and then bend them against me. All right, good. Now with your ankle. Okay. If you could point your toes down towards the ground, that is plantar flexion. Up towards the ceiling, that is dorsiflexion. And if you can rotate your ankle in, that is inversion and eversion, inversion and eversion. Okay? Flex up toward against me and down against me. All right, good. So that is that. So now if I could get you to stand up, we're almost done. How's that wrist?
It's painful.
Okay, no pain when I did that. I should have asked you that.
Should have caught that.
That's right.
Okay.
Are you lying? Are you trying to get pain medicine? Okay. Okay. So you're not dizzy or anything?
Nope.
All right. So with your shoulder, if you could put your hands all the way up towards the ceiling for me, that is flexion. Back down at your side. Now back behind you, that is extension. Okay, back side. Now both of them out to your side. That is abduction, and then each one cross over your midline. That is adduction. Okay. And then if you could put your hands behind your back if you're under arrest, that is internal rotation. And then back behind your head, trying to touch your shoulder blades, that is external rotation. Okay? We're going to do those same maneuvers. So up against me, back against me, out to the side against me, something like this, and then in against me. In towards your body. Yeah, there you go. And then nothing for rotation. All right, with spine, I'm first going to be looking at you from the side. There's no evidence of kyphosis or lordosis. And then I'm going to be looking at you from the back. I don't know which back to leave. Shoulder height is symmetrical, hip height is symmetrical. I think that's it for back. Okay, if you could turn this way for me. And I want you to bend down and touch your toes safely. All right, that is spine flexion. Yeah, keep down. And then there is no curvatures noted on the back. Okay, good. Stand up. All right, and bend back behind you. All right, that is extension. All right, good. And then come this way for me. All right, okay, and each side. All right, that is lateral bending, and then rotate on your. Okay, and that is rotation. Good. All right, so forward against me, back against me, side, side. All right, good. So range of motion is complete. All range of motion was within normal limits, and all muscle strength testing was 5 out of 5. All right, last system. Okay, so if you could walk this way for me regularly, looking at your gait and your balance, and that's within normal limits. When you walk back, if you could walk back heel to toe. Okay, that is tandem walking, and that is within normal limits. All right. If you could stand at your side, or stand here with your feet together, arms at your side. If you could close your eyes for about 30 seconds, I mean, with you checking balance and coordination and maintaining your safety, that is good. Okay, open your eyes. Now I'm going to be testing your proprioception and pronator drift. If you can, and the Romberg was negative. It would be positive if he fell over. Okay. If you can put your hands up in supination, which is holding a bowl of soup, okay? And then close your eyes. I don't see any pronator drift. Now I'm going to be tapping your arms and just bring them back to where they are originally. Okay, and so there was proprioception is kind of within normal limits, and there definitely wasn't any pronator drift. Okay. All right, so now I can get you to sit. start testing, okay? So the first thing I'm gonna do is some deep tendon reflexes. I do want you guys to note that you have to point out all of the places, but you only have to pick 2 to perform, okay? So I could do the the bicep reflex. I could do the brachioradialis, which is here, the patella. I could do the ankle reflex and the plantar reflex. Did I miss one? Oh, and the tricep reflex. Okay, so I'm going to be doing the tricep and the patella. So hold your arm out like this, really, really dead. Okay, clench your teeth for me. All right, some reinforcement. Thank you. Over here. Dead, dead, dead. Clench your teeth. All right, so that was 2+. Arm goes. Okay, for the patella. Okay. Okay, those are both 2+. Okay. Did you want me to do the other ones for camera? Yeah? Okay. So for the bicep reflex, I'm going to be finding this tendon. Thank you. Oh, and so for this one, make sure you say extension.